Well, October is a big month for anyone with Medicare coverage, right? Open enrollment will soon begin, and whether you've had coverage for years or you're just getting started, there are plenty of decisions to make. So Mike Kateri is a licensed insurance agent with HealthMarkets, one of the largest independent health insurance agencies in the nation. So you are going to help us out today, Mike.
We're going to try.
Okay, you come to the table, first of all, 15 years experience. You were saying you have been in this before, Obamacare started, before all these kind of changes to the market. So you can really help people out. Tell us, how does this open enrollment process work, first of all, and then we'll get into how you can help.
Sure. Well, the first thing that people need to be aware of are the important dates. As of October 1, Medicare eligible recipients have the ability to start looking at new plans, deciding which carrier is going to be the appropriate choice for them for the new year. However, just because you can make those decisions, people need to be very cautious to not send in those applications. You actually cannot send in the paperwork for the new plans until October 15. Carriers have said this year that they will destroy applications, and the enrollment will not count if it's sent in before October 15. Another equally important date is December 7. That is the last day to enroll. And unlike your taxes, where they just have to be postmarked by the 7th,
right,
these actually have to be in the carrier's hands by December 7.
Okay, so those are important dates to note. And is it a good idea? We mentioned the people who've had, Medicare for years, they've had the same plan. Is it a good idea to sit down and go over your benefits every year? It's
always a good idea to check back up, this year more so than ever. We have one carrier that's leaving the market, so certainly if you got your letter that your carrier is going away, you have to do a new plan search. But there is another carrier who's making major changes to their network of doctors and hospitals.
Okay.
Plus, if nothing else, people's medications change, their health status changes, and so it's always a good idea to make sure you're in the best plan or see if there's something out there that could save you a little bit of money.
Okay, now I've seen the literature that you kind of have to read through too when you go through all this, and you, having been in the business for so many years, probably are a big factor in being able to help take the stress out of that process for people.
For sure. The first thing is we go through countless hours of certification and training. We need to know the ins and outs of all the various plans. But if nothing else, we want to make it simple to understand, using terminology and language that our customers will easily recognize. And most importantly is that we sit down with them face to face.
Yeah.
We go out to their home, we will sit down with them at no cost and help them find the right plan completely objectively.
Yeah, and let's stress that because it's a one-on-one thing, a free service that you're offering because you are trying to get these people the best plan that's going to save them money, that's going to work for them. Mm-hmm. And let's face it, there are so many out there that we are overwhelmed as customers, as people sitting there looking at it. So we need somebody that can kind of leaf through for us.
Absolutely, and certainly that's something that we pride ourselves on. This time of year can be tremendously busy, and so it's important for people to call us as soon as possible and set up that appointment.
Yes.
But yes, we will absolutely come out to them at no charge and find the appropriate plan. Again, looking at all their doctors, looking at all the prescriptions that they take to make sure that they are in the best plan for the new year.
What are some of the things that people may not know about Medicare?
Well, there's really two things that are important to look at. One are all the extras that come with plans. Many carriers are giving free gym memberships, free dental, free vision, but one that's really become popular in the last couple of years are free over-the-counter drugs. So many things that you would go to the pharmacy for and buy over the counter, a lot of times the carriers will give you for free. And most people aren't utilizing this benefit. Many times it can be up to $400 a year of free over-the-counter drugs. The other is what's called LIS, or low income subsidy. Certainly many Medicare eligible individuals are on a fixed income.
Sure.
And when they have an unexpected medical expense, it can certainly throw their finances for a loop. And many people who qualify for these low income subsidies, where they can have reduced cost on their prescriptions or reduced out-of-pocket costs, they don't even know they're eligible for it. And that's why talking with someone like us we can help find that option and see if we can help direct them towards those plans.
Mike, I want you to let me know those dates one more time so we can make sure that people are aware of those.
So October 15 is the first day to actually send in paperwork. Even though you can start shopping now, October 15 is the first day to send in paperwork. December 7 is the date that it has to be in the carrier's hands, no later than that date, if you want to change plans for 2017.
All right, it's a busy time of year for you too, so you want people to call, make an appointment, right?
Yes, please
best
call.
Way to do it.
Yep, best way is to give us a call. Certainly they can visit our website as well, but by reaching out to us by the phone, we can send an agent to them. Typically within a couple days we can do that, but again, the closer we get to that December 7th, it's going to be harder and harder to get one of those time slots.
Okay, Mike, there you go. We have the phone number up on screen for HealthMarkets. I want to thank you so much for being here.
Thanks for having me.